Some of the one of the anti-vomiting medications that we've used has a spotty success rate. It's a pretty safe medication, so the ondansetron is worth a try. If it helps, great, and if it doesn't, you haven't lost very much. And then the gabapentin, as I mentioned, is good for the nerve pain, but some folks have found it useful for itching as well. Now, non-drug medications, because after all, if I give you medication, I've already given you 3 times already the spiel that you could have a side effect or interactions and stuff. So let's go for some stuff that can be useful without giving you those kind of side effects. And there's a pretty good long list of them. Now, why do they work? Well, if you look at this slice and dice model of the brain that goes from the top of the head down to basically the neck, you can see that there are all sorts of different areas of the brain and the early part of the spinal cord that are involved in pain. And they overlap tremendously. You've got areas there, and I won't go through the details, but point to areas that are affected with thoughts, memories, emotion. Midway down, you've got areas that affect breathing, heart rate, and blood pressure. And the pain pathways run back and forth and across all of those. So if you can do things that involve thought and emotion, you can already see that there are a number of places where they're going to interact. And so it becomes actually a very powerful way of reducing pain and anxiety. So cognitive factors, how a person thinks about pain influences how they're going to deal with it. All right? You've got Chicken Little. Little seed falls on his tail. The sky's falling, right? For those of you who heard this story, and nothing really good comes of that. That kind of catastrophizing approach that Chicken Little takes ends up taking him and Ducky Lucky and Goosey Loose and all that into Foxy Loxy's den, never to be seen again. All right? So really that kind of thought process can affect how things go. And then, of course, you can have the opposite. All right? The sky's not falling. It's just a crock of propaganda from a bunch of left-wing environmentalist wackos. All right? So it depends on how you look at things. All right? Now, self-talk is important. What do you tell yourself about your pain? I can't handle this. I can't deal with this. This is awful. Or, you know what? This isn't fun, but I've done this before. It goes away after a while. I can do this again. I can handle this. I'll be okay. And when you're in the moment, of course, it's hard to learn any of this. These are all things that you kind of have to learn at a slower pace. All right? When you're not in the midst of the pain, when you can actually start to process some of this. Biofeedback's useful in that it's not invasive, which is good. It tends to promote body awareness, because you'd be amazed at how many people go through and have a particular emotion that causes pain and don't even realize it. And then as soon as they kind of figure it out, they go, oh, I shouldn't do that so much. Right? Or I should do it a certain way, or I didn't realize my muscles were this tight. All right. The other things, like I said, like many of the others, there's not a lot in the way of side effects. And there are different ways of doing it. Obviously, some of the stick-on probes are not such a good idea for EB, but a clip-on finger probe, such as you see there, might pick up heart rate, body temperature, and you can learn to control those things as a way of getting overall mastery over your body. All right? It's usually hooked into a computer, and you get a screen to look at where, as you learn certain skills to affect your body, you can see the results on the computer screen. So it's like sort of being in a simple virtual reality kind of game. And usually kids really like that, because it's fun. It's not just another trip to the doctor's office to be poked and prodded. It's something that they can do actively that's kind of amusing. But the key to any of these things is the practice that goes on at home. So a lot of times this is done through a psychologist, sometimes it's done through physical therapy, in which case they'll often make a CD to take home and practice, just as kind of to remind you. And the more you practice, the better you get at it, like anything else. Coping skills training, again, the idea is to try to say, you can't necessarily make all the pain go away, but what can you do to have a life is really the bottom line on that. How can you get past the I can't do it because of pain to I'm going to do it in moderation despite the pain? How do you pace yourself? Because a lot of times I feel pretty good, and then I go out and overdo it, and I pay for it. All right? How to be more independent. Independence is a big deal. It's a big deal for any growing human being. Can be very helpful with anxiety, which is, as we've talked about, is a big deal. And increased self-efficacy. To say, I can do it. I can do 10% more than I could a month ago. I can do 30% more than I could 6 months ago. Look what I can do. and it eliminates some of that trapped, helpless feeling, which is awful. Hypnosis and guided imagery, another way of getting through a number of situations, often very, very good for dressing changes or short procedures. The key with kids is that it should be active. All right, it's not the, wait a minute, I got a gold watch. It's cheap gold plate, but it's not one of those you're getting sleepy kind of deals. It's more, tell me a story, tell me your favorite story, and encouraging them to take you deep into the story. Every little detail. You're on a beach. What kind of beach? Is it pink sand? Is it gray? Is it white? Is it fine? Is it soft? Does it blow around? All right. Is the air cool? Is it warm? Is it blowing? Is it still? Get into the minutia, and better yet, let them get into the minutia with you asking guiding questions. Kids will become so wrapped up in that they'll often lose track of a lot of what's going on around them, which is, of course, what you want. And use all five senses as much as you can get out of, get them involved in a story. And like many things, this can be a process. You may have to practice it several times. They may not have a story right off the bat. They may just have an inkling of a story. So fine, for this time, you do that much X amount of the story. Then the next time you do that much, and you take it a little further. And you can kind of practice in between the painful events where they can really kind of think about it. All right? It can be very, very useful. Low-tech distraction. Give them a pinwheel or soap bubbles to blow on, little stuff like that. And it's better, though, if you got a group of adults and one child, it's better if one person is the designated distractor. Because I see this all the time when we get kids off to sleep in the operating room, that you'll have like 5 adults there, the nurses and the docs and techs and so on, and everyone feels badly that the child is scared, so everyone's now talking. Gentle words. Take a deep breath, or what's your favorite activity? What's your dog's name? And suddenly their attention is just pulled all over the place. And then it comes back to the thing that scared them in the first place, because it's the only thing that is rock solid in their mind. So it's better if one person is the distractor, really draws them in and let everybody else kind of hush and do their business. It works better that way. There are techno distractions, of course. You got gaming and virtual reality. I mean, we've all seen plenty of our kids either, if they're old enough, texting or using the various handheld game devices or doing something on TV or whatnot. You can't get through to them. Dinner time. Coming to dinner? Yeah, Mom. Yeah. It works for pain too. All right. Adjunct therapies, other things. Yoga is sometimes useful. Now, there's this whole big thing in America that, yoga is, emotions I can't possibly even imitate. And that's not true. Yoga originally was a form of meditation, of learning to make small motions in your body and control them and really focus on them. So yoga, depending on which style you choose, could be done by anybody. You just have to kind of understand what you're doing, and it doesn't take a huge amount of understanding, and then it takes some practice. Meditation, same way. It's very similar in concept to what I talked about with the distraction or the hypnosis, where you take all that focus and shove it onto one item or one series of items, and you end up blocking out everything else, because there's only so much your brain is going to process at once, and if you can control what your brain is processing, you're also controlling what your brain is screening out.